All right, it's 7 o'clock. We'll go ahead and get started. We have a quorum. Everybody get a chance to look through the minutes? Any changes? Motion to accept them?
Make a motion to accept the minutes.
Brian Sims, is there a second?
Second.
All in favor?
Aye.
Minutes are approved. We don't have anybody on video. We don't have to do the roll call. Vote. Any wishes to be heard tonight? Seeing none. See all familiar faces in the crowd, no new staff to introduce. All right, we'll go to unfinished business.
Keep this really brief this go around. I think numbers are looking very good. COVID wastewater levels are the lowest they've been in a year, so that's great. Nobody in the hospital with COVID, flu, or RSV. Just looking, we haven't had any COVID deaths in about 3 months, and nor flu deaths in a couple months. So I think we're doing well. Just kind of a communicable disease update. The measles that you may have heard about getting popular, thankfully all still was in Allen County. Those are pretty old cases at this point. So there were 8 cases reported up there, none in any other places in the state as of now. So we felt like we did a good job of getting the schools prepared. So hopefully, if it does come around for round 2, hopefully we know what it looks like and how to immunize for it and titers and make sure people have the resources they need. So, but yeah, other than that, I think communicable disease-wise, we're doing well. Hospital census is down a bit, which is nice. Hopefully they're enjoying their spring.
Okay. All right, the Health First Indiana, the advertising for those awards. That's the next item.
So we'll talk about the why a little bit later, but we aren't going to be casting the net quite as broadly as we thought because we probably won't have as many community award funds to hand out. We think it's important to still do the community awards. That's a big part of what Health First Indiana does, but we'd like to still kind of target those. But we have reached out. We have a proposal with a local media company to help the health department with some social media posts and some videos to promote what the health department does in general and the Health First Indiana initiative. So we are still moving forward with advertising in general, the work that we do. But as far as the community award, we'll probably keep that a little more targeted. It's still on our website, it's still public facing, but I'll probably not put a lot of dollars behind advertising that.
Okay. Did everybody get a chance to look through the annual report? Any highlights, anything you guys wanted to?
We switched from the average age to the median age for deaths. Just it was a more probably accurate representation, which is just hold pretty steady the last several years. One second, guys. So I mean, I don't know if you can see this, but the median age you can see has been traveling down. I'm sorry, the average age, and then we switched to the median age, and it's been pretty flat the last several years. So figured that was probably more of an accurate representation. That way, we never want to lose any young folks, but all it takes is one, or motor vehicle accident of someone in their 20s to really pull down those averages. So the median is probably a better representation of how long people are living in the county in general. So. But yeah, I think that was the main reason we put this back on here. So just so you guys would be aware of that slight change we made to the annual report, because I think we went through that last time. So.
Any other questions on the report? Saw my daughter's name is now the most popular girl's name.
Oh, yeah.
she's 21 though. She's hip again.
You were ahead of the
She's
curve.
I guess
Before your time.
Yeah, Evelyn. Well, speaking of the district.
Yeah, just in your packets that were emailed to you was really the information I just briefly wanted to go over. Thank you to the coroner. I did want to highlight a couple of things that was in the coroner's report. They're doing some great work there, and really appreciate him or their department sharing their data. Some information. I'm not sure if there's many highlights in a coroner's report. But yeah, looking at county suicides, what was kind of interesting to me, your highest prevalences were 20 to 30-year-olds, which I've kind of expected. However, there's also another kind of peak around 55 to 65. So, 19 of the 25 suicides were gunshot wounds. So, we've been working really hard on overdoses. We may, not sure what that looks like in our county, but it is at least telling to realize that there are a lot of males, especially in their 55 to 65-year-old demographic with the gunshot wounds. That's kind of surprising. Kind of spinning a little good news though. The overdoses that were at 52 in 2021 were down to 19 last year. So I think a lot of that's awareness. Communities really kind of pulled together on really trying to educate people about what meth and all types of street drugs right now. Also, all of our Narcan efforts all around the county, including what we're doing with the health department, really seem to be helping. So it's a pretty cool thing to see. And then just briefly looking at some of the data that I pulled from the death certificates. Once again, about 2 years ago, our database changed where I can pull more specific information. So I gave you information going back several years in your electronic packet, if you would. I really just went back 2 years because this is probably more consistent with the way the data has been pulled consistently the last 2 years. If you go more than 2 years on that other information, you'll see that cardiovascular disease or cardiopulmonary death goes way down because I could finally figure out what these people are actually dying from. Anyways, a couple things to discuss briefly. Looking at a couple of the things that really went up, looking at 23 to 24, alcohol-related deaths went from 5 to 23. So we're seeing quite a bit of alcohol use out there, and so we may need to look at that more closely. Some different education campaigns or something along those lines.
Is that from motor vehicle accidents caused by alcohol?
Yeah.
Is that alcohol overdose?
You made a good point. Yeah, it's all kind of clumped together. Just from what I remember, a lot of it has to do with just long-term alcohol abuse. So liver failure and those kinds of things. So, yeah. Yeah, but I don't have the exact breakdown there. I'm sure there were probably a few motor vehicle accidents, but most of it was liver damage. And then we saw quite a bump in renal failure, which was a bit surprising for me. So we may need to look at what we're doing there. Anti-inflammatories, hypertension, diabetes. There's a lot of things that can affect kidneys, and we may need to look at that a little closer. And then just in the general deaths, if you would, we've seen a decrease in overdoses like I talked about, and then you can see COVID has gone way down from 25 to 14. So it continues to go down thankfully. And then looking at cancer deaths, colorectal cancer went from 48 to 33, which was great. Breast cancer 28 to 19, which is great. We saw a couple bumps in prostate cancer from 18 to 25 and bile duct cancer. So for any physicians in the room, keep that on your radar. Went from 4 to 11. So not a real common cancer that we see a lot of liver cancer, but the little bile duct that goes from your gallbladder and liver, and you can actually get cancers in there, and it's seen a bit of a bump. We'll see what next year does.
It's a very, very hard to treat cancer, so
Yeah.
that's why there's probably more deaths.
Yeah.
Probably relative to them. It's not like you're seeing a lot of it, it's just the ones that you do
The
see.
one that see,
It's
it
very
can
hard
be-
to treat, so they don't do very well.
And then, and then just overall looking at the top 5 cancers: lung, hematologic disease, colorectal, prostate, and pancreatic are the top 5. Pancreatic cancer is still not really a way to screen for that very well. So, once again, we're looking into different types of genetic testing. I think that may be the wave of the future, so that we can screen people that maybe have genes for pancreatic cancer. But it's definitely the one that kind of sticks out as a common cancer that we can't really screen for yet. Anyways, it's a lot of information. I'll probably stop there. And I gave you the old data just because I was looking at it this morning, and I was like, I wonder what these things were like in 2018, or so that's just for your own reference if you want.
Questions or anything?
Interesting. Yeah, it's a bit of a morbid task I do every year, but it is, I do find it fascinating, what are we actually dying from, right, in Hendricks County, so hopefully we can figure out some ways to address those issues. That's all I got.
Move on to new business. Start with the food ordinance draft.
So yeah, we have a new food ordinance drafted. The new food code did finally come out, so that is 410 IAC 7-26. That became effective April 16th. That was a little bit quicker than we thought it was going to be. We were told that it was going to be effective July 1st, so we had to scramble a little bit about that. So we really did not change a whole lot with the new ordinance. We replaced all of the 7-24 to 7-26 language. Some of the definitions changed just very slightly. So there is a summary of changes that was emailed out also. One of the only kind of larger changes that we put in there is that we would like our temporary vendors. It says in here mobile retail food establishments, temporary food establishments, and farmers market permit applications must be submitted 1 week prior to the start of the event. Otherwise, there's a $25 late fee. Applications submitted less than 48 hours will not be accepted. So currently, they have to submit it 48 hours prior to the start of the event. Otherwise, there's a $25 late fee. We spend a lot of time chasing down people that are doing temporary events, so it puts a lot of work on me and our inspectors to try and chase those people down, make sure they have the correct permits, because we hate to show up at an event and there be a food vendor that does not have a permit. We usually give some grace the first time we find somebody, but if we find them a second time, we'll send them home. So just some of the legwork in the office that we have to do, we would like to have those in a lot sooner. So that is the main thing. Any questions?
I mean, it's $25 to me is not that much. Could
Well,
you
I mean,
put
yeah,
some more
currently
teeth
they
in
have
it?
to pay $25 if it's less than 48 hours, but we did bump it up to a week. It has to be in a week ahead of time.
Yeah.
And then we can deny an application if it's less than 48 hours.
Do you get a lot of that? Are there a lot that miss the deadline?
Late fees, yes.
Do you?
Yeah, a lot of people submit it after 48 hours or less than 48 hours. So yeah, we do charge quite a few late fees. So,
$25 is one plate of beef, you know?
Are you asking, is that enough?
Right, I would
You-
say
you
you could
feel-
probably bump it up, maybe.
well, our permit fee is only 40, so I hate to bump it up too much.
Bump that up too.
Now, Vigo County, they charge a $150 late fee. And it has to be in at least 8 days prior to the start of the event with that $150 late fee, and they won't accept anything less than 8 days. So there's a variety of counties. I kind of checked with surrounding counties. Most places, it's like 48 hours to a week ahead of time. A lot of counties require the event coordinator to submit a list like 30 days in advance. So we don't do that just because I don't even know how to reach out to all of the events that are going on in the county to even contact an event coordinator. So we have some that happen every year, but we have so many events in the county that pop up each year. I don't even know how to go about that, so.
fine to keep it as is, but I think as we're seeing a lot of people trying to take advantage of that, then we ought to think about increasing those rates.
Yeah.
So we can just amend that.
And we would educate our temporary vendors too, we would start doing that immediately, we would do education with them for a while, and at a certain point, start enforcing that.
Any other questions? So we need to move to accept this new ordinance.
And forward it to the commissioners.
Yep.
I'll make a motion that we accept this new ordinance as stated in the summary of changes.
I'll second that.
All in favor?
Aye.
Any opposed? All right, immunization grant funding.
So the funding fund begins.
Yeah.
So the end of March, we were notified by the Indiana Department of Health that for our immunization grant, which we had 3 positions on that grant, 2 public health nurses and 1 administrative assistant. They said to immediately pause all work on that grant because they had lost the federal funding. Previously, when we had heard about funding cuts and that, it was like with the next budget cycle. It wasn't an immediate thing, so that was somewhat new to us. So we did some scrambling, got those folks moved over to some other funding, then found out the next week that we only actually lost part of that grant. So the part that we lost was anything that was earmarked towards COVID. So there were still COVID-related funds that were there to help get immunization rates back up that had fallen during COVID and that type of thing. So since those had COVID associated with them, those parts of the grant, that funding, we lost immediately. So we do still have some of that grant. It was about half of what we had left was lost. So we moved folks back to use up those funds. We will need to address it though. This grant cycle ends the end of June, and they don't expect any immunization grant funds to come out with the next cycle. So that's been a grant that we've had for a long time. It's supported by other funding other than COVID related. So we were kind of surprised that no funding was coming probably in July, but that's where we're at. So currently, just by chance, now we have 2 of those positions are vacant. So we're not filling those at this time. And we have 1 public health nurse that's on that grant that we will move to other funding starting in July.
Probably goes with the Health First Indiana.
I'm gonna say it all
These
kind of
two,
just.
So yeah.
Let's keep coming.
Yeah.
So yes, Health First Indiana, legislative session was interesting. It was proposed that the state would get $100 million for Health First Indiana for all counties. And that seemed to be pretty consistent until the end of the legislative session when revenue projections came out and everybody was scrambling to cut the budget. And so it was cut to $40 million. We did get our numbers last week of what that means for Hendricks County. So in 2024, let me back up real quick, I'm sorry. Before Health First Indiana, all counties were getting, was it 9 or 7 or 9?
7 million, was it 7 million?
I think so. I think it was just shy of 7 million is what all of the health departments got for local health maintenance. So, and then in 2024, it was 75 million, 2025, 150 million, and now we're at 40 million. So that's kind of what it's looked like over the last few years as a state. For Hendricks County, the allocations for Health First Indiana in 2024 were 1.7 million plus, 2025, 3.4 million. And then in 2026 and 2027, we expect 913,965. So we've got quite a cut to address out of the Health First Indiana funds. What that means moving forward is we've done a self-imposed hiring freeze. We want to protect the positions that we have, and look at what carryover we had from last year, what we can not spend. We still want to do the work that we're projecting to do, but where can we cut back and have some carryover from this year to kind of help us through as long as we can. Just kind of stretch that out as we can to keep doing the work that we've just implemented, so.
Was Hendricks County before 2024, do you know? The Hendricks County allocation,
I didn't look that up. I want,
was it under $1 million or was it
oh yeah,
way under?
I was way under, yeah. I want to say more like 2 or 300,000, somewhere in there. It was the local health maintenance fund and then our Indiana local health department trust account. So those together, I want to say maybe at the most 300,000. So, big picture, we're better than we were before Health First Indiana. So we just were gearing up all this work, and just, it was a little deflating to have that news, but staff has been great. The other change is they took tobacco prevention and cessation out as a core public health service. So we are looking at what the workload of our staff, because we had one person that was primarily focusing on tobacco prevention and cessation. That's still allowed for schools, so I think we're going to kind of shift her more towards school health and be more of the school health liaison. And we have a school health person who's a nurse, have her just do the vaccine part of it, and then perhaps start a FEMR or a fetal infant mortality review team, and just kind of shift what folks are doing. Luckily, most of our staff are on just a couple of job descriptions, so we have some flexibility. It's not like we had a tobacco job description. We had a public health education specialist. So we can easily pivot on what they're working on so that we can comply with those requirements.
So, I'm a little confused.
Yes.
Okay, removed as a core public health service, but can we still do stuff about tobacco cessation?
We cannot use Health First Indiana funds for it.
Okay,
So if we have other funding, we certainly can.
okay.
We just need to, with Health First Indiana funds, it's school health we can do. So they can do like vaping education as part of school health, but tobacco in general, we can't use Health First Indiana funds for that work. So we can have other funding that we're still working, still supporting our tobacco coalition that just started back up. We don't, we plan on still doing tobacco prevention and cessation. We just have to be very careful on who's doing it, how we're doing it, what funds we're spending.
Okay.
Do you want to talk about the immigration issue, or are you
Oh,
going
yeah.
to discuss that
Oh,
later?
yeah.
There's another issue with
I don't
Health First
have
Indiana.
answers for that one.
Can I ask one more question
Yes.
about tobacco? So prices for cigarettes have gone up, or supposed to, so that's I guess the deterrent or, from smokers, is that supposed to be,
Yes, that is supposed to be a deterrent, yes.
Here.
So yes, I did miss a big part of that, which we need to have discussions on how to address. And I want to make sure I get my wording correct because it changed at the end. And I want to make sure I'm not quoting
Just
old
in
wording.
case it just sounded good on paper. We just want to put
Well,
legal US citizens.
so it is, I think this.
Sounds good on paper.
Health First Indiana funds may only be used for Indiana residents who are lawfully present in the United States. That language was added to the Health First Indiana requirements. So we need to figure out exactly what that means. And again, this is for the use of Health First Indiana dollars. So we need to ensure that those funds are only used for Indiana residents who are lawfully present in the United States. Those are questions that we don't typically ask. So I think that's where a lot of the question lies. We didn't have any contracts that were specifically targeted to this population, so we didn't have anything in language that, there were other counties that did. They had some community awards that were specific to like those groups, so they have to address that immediately. But this is a requirement that goes into effect immediately, and we need to kind of figure out due diligence-wise what we need to address. I don't know.
I think when you're treating somebody or that type, when they're signing up for a program, you could essentially just have a checkbox and then it's up to them. They check the box and kind of like employment, if somebody provides you a social security card and to work, you've done your due diligence. So I think if you did that same way where they either affirmed or even just checked that, yes, I'm a lawful Indiana resident, that I'm lawfully permitted to be here, lawfully present in the United States. The question, like that Krista had about like the tire, like people just pull up and, for the tires, that type of thing. So I don't know if potentially just a little disclaimer that the tire amnesty is only valid for I can't remember where we only allow in Hendricks County residents.
We did say Hendricks County.
So you could say Hendricks County residents that are lawfully present in the United, something like
We
that.
didn't strictly enforce that, but that's how it's
Correct, but
advertised.
as long as you had it that way, for those two, I think that's probably a sufficient way to do it. And I think if you're relying on them to do it, I think that's probably sufficient, meaning them to tell the truth, that's probably a sufficient way to do it.
So some of the work that the staff that are funded by Health Indiana is like doing educational tables at events, presentations at schools. I mean, there's some things that it's not specific necessarily, it's a service to the population, but it's not like we're serving one-on-one.
Yeah, I don't think an
individual.
educational activity, you'd be in violation if it just so happened that there was somebody here illegally or that lived in Ohio. I mean, what are you gonna do for these counties that are right on the state line and somebody decides to come over from Ohio? Are they violating the statute? No, no one's gonna say that the fact that you sat in on a presentation, that type of thing. Now, if you're tailoring that presentation solely for that, then you likely would have problems.
Yeah, I would agree with that. It's who are we targeting with the program and the funding intentionally as far as what the mission of it, that particular event or outreach or care. But if it's generally care for the community and the public in Hendricks County.
I wouldn't recommend the health department going to like a rally for
Yeah.
illegal immigrants, something like that. So probably not the place to go based on the statutes.
It's like Healthy Families. Are they Health First Indiana funded or are they separate, right? No money.
They were partially, but they're not.
Not now, yeah, right.
They did have one position that was, technically still, finish that, but
Yeah, I mean, that's,
not now,
that's what that, yeah.
because we didn't want to.
Let's not help the people that probably need help the most and are more at risk for limited resources in our community.
I guess on health, on your situation, is your target the child or your target the
Right.
family? If the child is an American citizen, then
Yeah.
but if you're, kind of providing services as well to the parent, I don't know how they would interpret something like that.
Well, if there's clarification that you need as you go along, then bring it here as any specifics, or if you feel like guidance, just let us know. But it sounds like you guys are thinking all the right things. I don't think you have too much to add as a board, just unfortunate.
make you aware, and if there's other ideas on how we can shift things around.
Eric's idea of essentially a disclaimer on some things and anything that has to be signed off on, make them responsible for saying yay or nay.
Check the box.
You've
Off the
done
hook.
what due diligence you can at that point in time. You're not deputized as ICE agents.
Yeah.
Okay. Budget requests in that, or?
So, we will be submitting budget requests, so that's where we need to crunch numbers and see exactly what we're picking. We're gonna utilize all carryover we can, but we need to find out exactly what that dollar amount is. So, the Health First Indiana budget is due to this, for next year, is due to the state June 1st. So, and we'll soon be submitting all of our county budgets for consideration. So over the next couple weeks, we'll be crunching numbers and be able to really identify which positions will be under which fund and kind of make those shifts and adjustments. But I don't have final budgets to share today before I submit. I would have liked to share it with you before we send it on, but since we just got our number and we're still scrambling a little bit, so we'll share that as soon as we have it.
Any other new business not on the agenda? Okay. Need to go to updates. Lisa?
Yes, I don't really have a whole lot of updates. I was going to talk about the new food code, but we already kind of discussed that with the new ordinance. Again, just because it became effective April 16th, we scrambled a little bit to get the ordinance updated, all of our forms changed, stuff on the website. Our food inspection program where we input our inspections in had to be completely changed. So the person, Mark Christie, that does our IT stuff for that, it took him a minute to get some stuff changed as well. He had been working on it, but still he thought he had a little bit more time too. But otherwise it's going smoothly. We've been out doing inspections. Inspectors are taking a little bit longer in the field to do inspections because they're educating owners and managers on the new provisions of the code and answering questions, which the state really does not want us documenting violations until January 1st of next year. So we are doing a lot of education for that. I think House bills, we were kind of following 3 House bills during the legislative session, and only one passed, which is House Bill 1577, which is regarding a statewide mobile permit that was signed by the governor. So that does not go in effect until January 1st, 2027. So we're not really quite sure how that's going to work through the whole state. There's a lot to be figured out for that. So we'll kind of see how that goes. And then the only other thing is our Indie Tattoo Expo. If anybody's looking for a tattoo, it is June 6th through the 8th at the fairgrounds, and they just dropped stuff off today. We have 195 artists from 79 studios attending, so that'll take us a minute to inspect. It's my favorite day of the year. I look forward to it every year. I love it. It's my favorite. It's great. It's great. Okay. I don't have anything super riveting. Aaron and Zach completed their CPO courses 2 weeks ago, so now they are certified pool operators. So I was getting them trained. So we're switching gears on septic and healthy housing from educational to, it's about to be like boots on the ground season. It's getting warmer. Pool opening season's underway. As of today, we've got 14 locations open for the summer pools. So over the next week and a half, everybody will be sprinting to that finish line before Memorial Day to get everybody's pools open. It's always a fun week and a half inspecting outside. It's fine. Mosquito surveillance. We'll start setting traps towards the end of the month. State Lab is not accepting mosquitoes yet. So we've set a few test traps just to kind of teach Zach how to do it. Kind of get our brew getting kind of smelly and great for the mosquitoes to be attracted to it.
We don't submit those until probably the beginning of June. They test for West Nile, lacrosse, and Eastern equine encephalitis. We don't normally get positives on those. Normally just West Nile towards end of summer, early fall, so not super concerned yet. We were watching House Bill 1052, that did wind up passing and getting signed by the governor. It doesn't really affect us right now, quite yet. It addressed tie breaks on the technical review panel, and it set amount of time that they are allowed to meet during the year. It also voided all ordinances passed after January 1st, 2025, so ours is safe, it's fine. And then it also sets deadlines for the state to update their residential codes by July 1st of 26, as well as inspection guidelines by July 1st of 26, so that will be kind of interesting to see. And then they need to do the same for commercial by January 1st of 27. So I'll watch those, see how it goes. I don't think there's anything proposed that is super life-changing at this point in time, but you never know. No septics have gone in this yet, but we're getting calls for plasticity tests, so maybe septics soon. I don't know. Tis the season for change. It's great.
Man,
Yeah, so we had one staff resign her position, Kirsten Ritchie. She'd been with us for a little over a year and a half. And around that time was when we found out about the Health First funding. So it kind of made sense to just switch everybody around on the funding end, and we just won't replace Kirsten's position for right now. So we're still up a staff from what we were 2 or 3 years ago. So right now we're just kind of moving everybody around and figuring out what allocations will be now. Lisa and Jerry Ray, who's our latest hire, will do home visiting full-time, and then we'll kind of figure out what we're gonna do with Rebecca's a supervisor position. She sometimes does direct service staff as well, so we'll just kind of figure out what we need to move around as far as those allocations. Other than that, I mean, it will just affect how many families we can serve, because we do have managed caseloads, so we'll have to refer some of our referrals elsewhere who may have openings, because we will probably be full. But other than that, I mean, our RFP won't come out until the end of this year, so in terms of budgets and new budgets, we won't be dealing with that until 2026. We did have some interpreter services funding that expired on DCS's end, but that was planned to expire. We knew that was coming in advance. So we will have to manage how many families we serve each month who require language services, but we've been aware of that, and we've been doing that for a while now. Just because those families also are usually a little bit more higher need, and just scheduling an interpreter can take so much extra time. So we've already kind of managed on our end how many families we enroll each month who need language services. So other than that, you know, we're at the new office, and that's running smooth and going well, and I feel like everybody's settled in, and I think that's about it.
cool.
Our SUV clinic, Susan put together, we're calling them risk reduction kits. So basically like some wound management thing in there for patients. So we'll offer those to all patients seen in the clinic if they want it. And then the nurses can also offer those to any patients that we see. And then the clinic that we had with the IIC in October at the fairgrounds, they gave 573 vaccines to 140 patients. And we have one scheduled with them in June. It'll be at the Maid Center in Plainfield. We try to do 2 a year with them to get another location for people to get vaccines. And then Cassie, who was on our immunization grant, her last day with us was March 14th, which worked out nicely because then the funding went away late, so she left before that. But and then we've been working on immunization strategies. We meet with Dr. Stoppridge and Krista Nelly, who focuses on immunizations, just to find out some ways, collaborate, that we can increase immunizations in the county. So we worked with Vital Records and Lindsay. Lindsay put together a packet for us to give out with birth certificates. and we're giving it to anyone 18 years and younger that's picking up a birth, like if they're picking up a birth certificate for someone who's 18 or younger, they also get the immunization information. Or is available to them, something like that. And then we're working on putting together some information for people to find access to care, so how they can find what physicians are accepting new patients. Like some QR code that we could put together that will take them to the different hospitals' websites so they can see which physician they could get into for care. And then we can run reminder recalls that will catch people who are missing vaccines, and we can contact them via phone and letters, so we'll be doing that quarterly. And then along with the funding, the state was helping us with our communicable disease investigations, so that funding has stopped. So our nurses are doing all of the communicable disease investigations again, which we had talked about taking back so we would know better what's going on in our county anyways. It just happened sooner than we had planned, but so the nurses are busy doing all the investigations again.
What are you doing for the MMR askers, the adults that are coming in? Or do you have like the age stratification kind of?
So we have the standing order that the CDC wrote, and then we wrote an addendum to that basically anyone who is requesting it that doesn't have proof of documentation or has a titer that shows they're not immune, that we can give the vaccine to. So if they say, I don't have my record, we can
No
give
matter
them
what
the
age,
vaccine.
no matter what.
Yeah.
Has that been high volume or not?
When we sent the information to the schools, we had a lot of teachers that were born in 57 or later, and they were like, I don't know if I'm immune or not. So we did a lot of talking with them, and we vaccinated some of them. Some of them got titers. The wellness clinic, I think, had some questions for us, but it's slowed down. But initially, there was a lot.
I think another point too on the, if you're looking for providers like in the community that are accepting patients, don't just go to hospital systems. Especially pediatrics, there's a lot of independent pediatric groups around and family medicine groups around too, like they're not hospital owned. So keep those in mind with those too, they'll probably take your patients as well. Anthony?
Before I go, does anybody want to know the Pacers score?
Yes.
Yeah, Cavs 31, Pacers 19. Into the first. So Adrian, Michael, and Danielle recently presented to second graders at Mill Creek Schools. Talked about proper hand washing. We did a germ demonstration. Adrian talked about smoking cessation, and Michael did a small presentation on food safety. But I wouldn't have expected, well, I guess I would. The second graders were pretty excited about the whole thing. So they had a much better turnout with the second graders than they did a few days later at Plainfield High School, where the high schoolers did not engage at all. So we did the Kegs and Eggs event at Avon Park, Washington Township Park. We mostly just promoted the STI clinic that day. I did not anticipate we would see much activity at all, but surprisingly, we had a lot of people stop. Actually had some questions about measles vaccines and immunizations, so it was a good event for us. Preparedness just got back, Jeff just got back from the NATO Preparedness Summit, the national one in San Antonio, so that was a good thing. And even though she's not gonna have as much focus on tobacco, Adrienne, in the span of about 2 weeks, completed 88 tobacco assessments. So basically what she did was she went around everywhere in the county where you could purchase tobacco that she knew of, went in, kind of covertly, but not really, just to see what kind of products they were selling. And her findings were pretty interesting. Turns out there's probably some places here in the county that are selling things they should. So it's mostly just data collection. She just took all that information, sends it on to the state. So she worked really hard on that.
What does that mean? Like selling things they shouldn't, like they're not licensed to sell tobacco?
Illegal things. So, you know.
THC
Yep.
stuff, okay.
Yeah. Yeah, and they also have, it's interesting, some of the products that are actually vapes that most parents or people wouldn't suspect are vapes. And evidently, a lot of those aren't really legal either, so. And some of the places she would go into were very, very willing to show her things, and some were not. And she did have a few ask her to leave, which she did. But, like I said, it's good data for the state to have. I don't really know do you know what they do with it? Did she tell you? I don't know that they do.
I think mainly it's educating people,
Yeah.
this is what's out there available.
But, I mean, she canvassed the whole county, so, yeah, it was a lot.
And she went covertly, you said? She didn't announce who she was?
Well, she kind of goes in, so she can use her phone to put the information in, there's like a survey there, or she likes to go in just with like, a pad of paper and write things down. She tries to go in and do it discreetly, just kind of like I'm walking around the store, I'm looking, but she's not always able to do that because, there's not a lot of people there, and if they ask, she has a letter that she presents, kind of explains to them what she's doing. And most of the time, they take it pretty well. Like I said, every now and then she'll get one that was not wanting her there, so. But I think it was a good information gathering exercise for her, for sure, so. She did this before when she was in Elkhart County, so she knew what she was doing. We launched our diaper pantry in April, so we've had so far 23 different referrals from various partners. So that's been good, but I am getting low on diapers, so if anyone knows someone that wants to have a diaper drive, let me know. We also launched, in April, we did our first suicide and overdose fatality review meeting. Went very well. We've had great participation, and we had another one last week, filled the room. So there's interest, and it's a good learning experience for all of us. It's eye-opening. His numbers, were those 24 numbers? Were they? Okay.
2024 coroner's report was where most of
Okay.
it was.
Have we need to talk about it, because I think the numbers we have are a little bit different from what you've got, so.
Yeah, I mean, it will be probably a different subset, so, coroner's not, yeah, it may not just be Hendricks County residents that he's reporting on, so the numbers may be a little different.
But that's gone very well. Olivia's done a great job, so that's all I've got.
Michael shared his website last time. Is that something that you guys are talking about as you're in the community yet, or is it what you do with some of the outreach, or are you directing people to go to the site for other community resources?
On the website that
Right.
Michael,
When
yes.
Michael was creating, I didn't know if that's what you guys.
Yeah, the resource guide, yes.
Yeah, yes.
Uh-huh.
Okay, gotcha. How's that going? I know
It's going well. It's going well. We want to revamp the website, the county website. That's kind of a work in progress. So we just ordered paper copies of, not the resource guide, sorry, my brain is not functioning tonight. I feel like we have a lot of stuff going on, but yeah, Michael's on top of it. The resource guide is great. Yes, that's it, the health department brochure. We're trying to get the word out. People don't always know what we do and what we can do, so we're working on ways to get that out there.
Anything else, Krista?
So as I mentioned, we're putting together budgets. All staff performance evaluations are due by June 1st, so we're doing that as well. Mentioned Tire Amnesty Day this year, that will be held on August 9th. So we're gearing up for that. And then I have one more funding update. This week we learned that the preparedness grant is going to be reduced. We don't know how much yet. So the preparedness grant covers the salary for a preparedness coordinator, but is not enough for benefits. That comes from other funding. It's just the salary portion is and mileage, I think, is what it covers, and it's in two parts. We know one part has been 25,000, will be 20,000 at the most. The other part, they don't know yet. So they had submitted everything to CDC, who funds this, and so they're waiting to hear back on what will be allocated to the state to share with local health departments. That grant usually starts July 1st, And they said with this process, it may be delayed. So we're just figuring it out. We'll do some shuffling for that too, in case it's not ready to go on July 1st.
Okay.
That's it.
That's all the good news.
That's all the news I got tonight.
That's all the good news you have. Dr. Stockbridge, anything?
No, just, it's, with all the funding changes and everything, just, we just really have a great crew. And like I said, we will be creative with the funds we have. People are willing to change their job titles a bit and very flexible, which I'm very, very appreciative for. We'll be okay. We'll be okay. But yeah, we got to crunch some numbers and figure out where what we're prioritizing a little more of this go around, but we'll be all right. That's all I got, really.
There's some days to remember on the agenda there, the Talks Away Days coming up. Larry, anything from the county council?
Well, every year at the end of the legislative session, I think, how did those folks get to be in the position they're in? They obviously have greater knowledge than I have. I know if I was having difficulty meeting my obligations, the last thing I would do would be to cut my income, but they seem to think that that's the solution. So they think it's also the solution for local government. And our income as a county is going to be diminished. What we had been receiving from personal property is going away, and it's substantial. We're cutting the income tax, of course. So we're going to be struggling a bit. We have a meeting coming up with our financial advisor to give us an update, his impression as to what the impact will be on the county and our income. And then the commissioners and the council have a joint meeting later to, in essence, plan how we're going to meet the crisis. We know, I think, we're confident, I believe, we're going to have to raise income taxes at the county level to make up part of the shortfall, which is sad because it's hitting the people who can least afford to pay those taxes. Businesses are sort of getting a, not a free ride, but a better ride than they had in the past. So I don't know at this point what the outcome is going to be, and may not know for some time. It's going to be worse in 2027 than in 2026, and 2028 is going to be even worse than that. So it's going to be a struggle. Fortunately, we do have some very good folks on the council that I'm more than happy to work with, and our commissioners are great folks too. So we'll do the best we can with what we have to work with, but it's going to impact every office, health department, and every office in the county. And just ask for your cooperation, which I'm sure that's not going to be a problem, but your patience. And as I say, we'll do the best we can.
Larry, this is just an editorial comment, but the powers that be downtown, we'll see if they are wiser, as you said. They seem very much bent on advertising Indiana as a low-tax state. Well, low tax also means low service. Every time I see any kind of study about what attracts people to a community or to a state. It's not necessarily low tax, it's quality of life and services provided. The governor and the folks in the legislature want to advertise we're low tax. Well, obviously those, you're just shifting dollars and putting the burden, as you said, on local units of government to want to keep services the same, you gotta raise the local tax, so it's just a giant shell game. Unfortunately, the folks downtown don't see it that way.
But the governor was of the opinion that there's a lot of waste in local government. And I've been involved with the Association of Indiana Counties now for many years. And there is an amazing lack of waste. We're in good shape compared to many counties. So I don't know how some of these counties are going to survive. Bankruptcy may be their only solution. So the effort that was made on behalf of the governor is based on a faulty foundation as far as knowledge. And it's not just, it's schools too. I remember listening to an economist 2 years ago who was talking about what happens when you cut funding for education. It's great to say this is a great state to come to, low taxes, but as he pointed out, if you don't spend money for education, you're going to end up with a population that is not as well educated as other locations. And at some point, employers are going to be looking for educated employees, not low taxes. So it's sad.
Eric, anything on your end?
I mean, it's a good thing we had our septic ordinance because it could say the exact same thing, and if it passed on January 1, it's void, even though. So, and I mean, it's ridiculous what some of these bills did, like that one. Technical review panel, I believe, didn't meet in December, and so all these counties that were waiting for ordinance to pass now are no longer valid. So there'll be a lot of, I think, things over the next couple of years where we figure out all the stuff we have to figure out how to fix because of some of these changes. So.
Good times.
Yeah, we made it done with a good
Job
show.
security, I guess, for all of us then. Job security. Anything else on that? Can I get a motion to adjourn?
Motion to adjourn.
So moved. Go Pacers.
All right.
You know the reason why